It's amazing for me to see, as a sports physician, what the human body is capable of from 3 to 103, because there's 100-year-olds out there that are going out doing big bike rides or running half marathons or marathons. It's incredible.
Dr. Andrew Murray is an utterly astonishing athlete. He ran from John O'Groats, not to Land's End. He ran across Europe, into Morocco and to the Sahara Desert. A consultant in sports medicine at the University of Edinburgh, he also takes public clinics which are stuffed with injured runners and cyclists, including at times me.
There can be such a thing as too much. So if, for example, you're going to do 20 hours of running per week, then again you get huge benefits. So you get an overall massive increase in health the more exercise you do, but there is a point in time that that levels off and indeed would come down the slope in the other way as well.
These affect cyclists, runners and more.
Once you do more than your body is used to, then that's when your body will sometimes complain and you may get overuse or overload type injuries. And when I ran, for example, from John O'Groats to the Sahara Desert, running 60 kilometres a day, that was more than is beneficial for health. So
you injured yourself and you kept going.
Yeah, and again, that was fun. It was something to talk about.
My left Achilles is pretty sore. I suppose the one thing that's a bit worrying about that is that Achilles tendinopathy is just degeneration of the tendon that I suppose you push off with every single step. And the advice is basically you should rest. And I don't think many of the textbooks will advise that either rest or perhaps run 2,600 miles to Morocco.
4 factors contribute to overuse injuries: internal biomechanics, external biomechanics, too fast an increase in intensity, or, very frequently, too rapid an increase in volume of exercise.
Probably beyond 15% per week is where you're more likely to pick up an injury. But it's not just about how much you're doing, it's about how aggressive you're doing it as well. So if you increase the intensity too quickly, then again, that can decrease your body's ability to adapt, and it can also increase your injury risk. So it's about introducing circuits, or it's about introducing your sprints or your harder sessions, or even hill running on a more gradual type basis as well. The third factor is internal biomechanics, so the way that your body moves. There'll be certain things that make you more efficient. So people that have got strong glutes, people that have got strong quadriceps are less likely to get Achilles issues, are less likely to get pain at the front of their knee, which are again very common issues in runners and in cyclists, for example. And then there's external biomechanics, which is, for example, the shoes that you're wearing to run, the bike setup that you've got, or the terrain that you're running on as well. So it's about all 4 of those factors, and it's about making any change that you do on a gradual type basis. And if you are, there's absolutely no limit to what you're capable of, but it's about making those changes slowly rather than rapidly.
That's better. Good to go. All right, see you guys later.
And even a small change can make a massive difference. For example, when I ran to the Sahara, I was running 60 kilometres per day, and I couldn't actually change the amount that I was running because I had to, reach the Sahara and get home in time for my wedding. But what I could do is change my biomechanics slightly, so I just changed my stride length. I also stopped rotating my foot quite as much, and I was fine after that. So even though I had Achilles tendons that looked like sticks of rhubarb, they got better with small interventions that made that difference. And that was thanks to a podiatrist and thanks to physiotherapy input that I got. If you are doing that amount and you're getting injured, usually you can just dial back a little bit, either in the volume or intensity, and that should sort it out. So avoiding a change in shoes or bike setup suddenly, just gradually transitioning from one to the other, from old to the new. And then seeking help if you're not quite sure, if you're stuck, if things aren't quite working out. You could see a sports and exercise medicine doctor, you could see a physiotherapist, you could see a podiatrist. And I guess if there's specific issues, then you could be seeing a nutritionist. So I think it's just recognising there are people out there that can help, and they can look at what is the nature of the issue you've got, how can we get you better, but then also how can we prevent things coming back as well.
Andrew, together with Donnie Campbell, who is in episode 9 in this series, ran Scotland's 10 highest mountains in a single day. I worked with them on this, and I am hugely grateful to Adventure Show Productions for allowing me to use all the great extra footage in this video. Even elite athletes like these genetically gifted individuals emphasize the importance of what Dr. Murray calls the foundations.
The same foundations that can actually help you be at your best are also things that can keep you active and prevent you getting ill and injured. So one of the most important fundamentals is sleep. So actually getting somewhere between 7 to 9 hours sleep per night really can enhance how you are, your mental performance, your physical performance, but it also significantly decreases risk of illness and also injury. Muscles are made of protein, so good quality regular protein can really help enhance and maintain muscle function and muscle bulk as well as we get older. Regular immune top-ups as well, so fresh fruit and vegetables, anything that's colourful except for Skittles and Haribo, are generally going to keep your immune system topped up and your body working nicely. And fuel for the work involved, so if you're driving a car, if there's no fuel in the tank, you're going nowhere. So if you're doing sustained aerobic exercise like a long walk, a long run, a long cycle, then some carbohydrates to top up the tank can be helpful. Regular physical activity is actually the single best thing that you can do for your health. So a 30 to 40% reduction in anxiety, depression, dementia, all these things, and also can be a powerful treatment of these things when it occurs. The 30% off an early death, you also get somewhere between 30 and 60% off heart attacks, strokes, type 2 diabetes, and hip fractures as well. So very good for physical health and also good for longevity. People live longer if they're physically active. The things to do, especially for older adults, would be to maintain not only aerobic fitness, so walking, cycling, running, doing things that actually help increase your heart rate, but also things that enhance strength and balance as well. So just making sure that you're lifting heavy stuff, that might be in the garden, it might be in the gym, it can be a range of settings. But that strength and balance again is really powerful for mental health and also for physical health and also for maintaining function, decreasing the risk of fractures, hip fractures, further on in life as well. And also social connections, spending time doing things with people that you enjoy spending time with or doing things that you like. Really, really important. People often forget the last of these.
There's a great podcast with Dr. Murray talking about that massive Sahara Ultra Run and others around the world, linked in the video description. My thanks to him and The Adventure Show for the pictures. This is just one of a series of older athlete videos covering in detail lots of these topics, and there are more in production. You'll find the existing ones here, and adventure cycling videos are here, and I'll see you again next time. Goodbye.